Good evening, my name is Jill Tiefenthaler, and I have the pleasure of being the president here at Colorado College. It's really wonderful to see such a great turnout tonight for a presentation on an incredibly important topic, the spread of the Ebola virus in West Africa. And we're very fortunate to have right here on the Colorado College faculty an expert on the effects of disease on political and economic stability. Professor Andrew Price Smith, for those in the audience know him as APS, I think, has been at Colorado College since 2005 and is currently the chair of the Political Science Department. He also directs CC's Energy, Environment, and Security and Global Health programs. Professor Price Smith has held previous appointments at the Earth Institute and the School of International and Public Affairs at Columbia University and at the University of South Florida. He earned his PhD in political science from the University of Toronto. Professor Price Smith is author of several books, notably Contagion and Chaos, Disease, Ecology, and National Security in the Era of Globalization, which won a Choice Magazine Award for Outstanding Academic Volume of 2009. His other books include The Health of Nations, which was shortlisted for the Grawemeyer Award, Plagues and Politics, and U.S. Foreign Policy Enduring Challenges. His latest book, Oil, Illiberalism, and War, Energy and U.S. Foreign Policy, will be published by MIT Press in 2015. Professor Price Smith has testified on climate change, disease, and international security before the U.S. House Science and Technology Committee. He's also served as a consultant to the United Nations Institute of Peace, the United Nations Development Program, the World Bank, and the U.S. Environmental Protection Agency. Please join me in welcoming Professor Andrew Price Smith.
Well, hello, and thank you all for coming tonight. Tonight we'll be talking about the emergence of a new epidemic in West Africa, specifically the Ebola Zaire virus. I'm going to speak for about 45 minutes, and then I'll entertain questions. So please hold them until then. Thanks. And there's quite a bit to roll through here, so I'll try to move without being too rapid. I'll try to move with some expediency. So in terms of the epidemic as it stands, there are 5 subtypes of Ebola virus, as you may know. This one is called Ebola Zaire, and it is typically the one that exhibits the greatest mortality or the highest death rate. The affected nations at this point in time are Liberia, Sierra Leone, Guinea, Nigeria, and now Senegal. I put DRC, the Democratic Republic of the Congo, up there in brackets because there appears to be a parallel outbreak beginning in DRC, but it's not related to the current epidemic raging in West Africa. It appears to be an entirely separate Ebola outbreak. In terms of mortality or deaths from the disease, as of this last weekend, there are approximately 2,200 dead. Morbidity, or those infected, is around 4,000 infected, but that's a minimum rate. The WHO, the World Health Organization, has indicated that, in fact, a lot of the cases are not being reported because people are simply not seeking help in the hospitals. Rather, they are staying home. And so there are a considerable number of cases that we think are unreported or underreported. The WHO projects that there could be as many as 20,000 cases by the end of the year. That may sound very high to you, but in fact, if you look at the exponential growth curves that we're now seeing in Guinea, Liberia, and Sierra Leone, it's not at all out of the question. Okay. So in terms of the fatality rate, it's approximately 52%, but there's enormous variance across the region. It's as low as 38% of infected victims in parts of Guinea, but it's as high as 58% in and around Monrovia, the capital city of Liberia. We're seeing pronounced movement from rural regions into urban centers, and that's only probably going to intensify. So you're really starting to see the epidemic taking off within the capital cities, the major cities of the region. That, of course, is a nightmare because when you look at the population densities of those cities and the ease of transmission, it sets up for a rapidly expanding epidemic. The Ebola virus's typical path through a human being, you can see this. I don't have to read it out, all of it, but typically by day 8, you're seeing onset of the virus, and it presents initially as headache, fatigue, fever, muscle soreness. Then you get into vomiting, bleeding, and so forth, brain damage, bleeding from various orifices in the body, and ultimately loss of consciousness and massive internal bleeding and death. So it's a very nasty virus. And one of the problems, of course, with this is because it's such an ugly way of dying, it's such a nasty virus, it generates a lot of fear. Quickly, vectors of transmission. Ebola is not airborne. Just want to clear that up. You cannot get Ebola through water, and you can't get Ebola through food, at least not easily. Now, I suppose if you ate off the plate of someone who was infected with Ebola, you could get it off that way. But if you mind your manners and don't touch someone else's meal, you're probably not going to get it from them. So you can only get Ebola from touching the body fluids of someone who's been infected with it or has died from Ebola. The corpses are particularly bad for this. So you can get it from sweat. You can get it from saliva. You can get it from tears. You can obviously get it from blood. You can get it from feces. So there are a number of vectors of transmission, but it's predominantly tactile. In other words, you're going to pick it up through that mechanism. One of the things, though, about the Ebola epidemic that's not really being talked about is that it's not just the morbidity and the mortality generated by the virus. It's the fear. And I've examined epidemics over the last several thousand years in my work. I've been studying it for a long time. And in my opinion, fear and the fear generated by epidemic disease is just as dangerous as death and illness. In the case of the Ebola epidemic, you can see there are literally bodies in the streets of these cities. And those bodies are literally viral bombs, okay? People don't want to touch them because if you touch an infected body, you run a very high probability of getting the illness. So the government of many of these states has simply left the corpses in the streets. It's awful. In this, you've also seen fear-generating runs on banks in the region. Now the hoarding of food is intensifying. In fact, I talked to someone who has family in Liberia this very morning, and she was going on about how people literally will not leave their homes anymore unless they are armed because the climate of fear and violence is so intense that people are literally being attacked in the streets for whatever they have. So civil society is really kind of starting to break down in much of this region. We're also seeing the increasing mistrust of medical personnel and of state personnel. People in the region are now seeing hospitals as abattoirs, as places where people go to die, not to get well. And so the trust in the doctors and nurses is declining. The trust in the state is declining, particularly as the state starts to crack down in an even heavier way upon the people. And of course, what you're seeing is that panic is leading to rioting and violence throughout the region, and it sets up this spiral of panicking and violence that leads to political oppression. So the more that the people become afraid, the more they are reacting, all right, and engaging in civil disturbances, and the more the state is clamping down on the population, which of course only serves to intensify people's concerns about a repressive state. And so it's generating a pernicious feedback loop. In many ways, this echoes the exact type of dynamic that we saw in the cholera epidemics that swept Europe in the 1830s. In the 1830s, these types of dynamics were similarly visible, particularly in France and in Prussia, the precursor to Germany, because people felt that that the state wasn't really looking out for them, that doctors were behind cholera and so forth. And so mobs literally attacked doctors and agents of the state in the 1830s across Europe. Again, mobilized by what? By fear, right? By a lack of understanding. My argument here is simple, is that in the modern age, we like to think that we're different somehow than past generations, that we're superior, that we're more enlightened and more rational. But I would argue that when people are put in the situation where they are faced with a highly contagious and lethal pathogen, they tend to behave in a highly irrational fashion. And this is not unusual. All human beings do it. We saw it in SARS in 2003. We saw it to a degree with the H1N1 scare in 2009. We've seen it with the cholera epidemic in Haiti that has raged there since 2010. And you're now seeing it again in this case with Ebola. The effects on healthcare workers are really pernicious in this case. What we're seeing is that doctors and nurses are really are being infected at an exceptionally high rate throughout the region. And you can imagine why. They don't have enough protective gear. In fact, in Liberia, roughly half of the medical staff in many of the hospitals that we know of has literally either been infected or have fled their jobs out of fear. So you're looking at really the debilitation, the crippling of already very flimsy national healthcare systems across the region, and that can only intensify the epidemic in the days to come. This is quite worrisome. Again, it's almost like a reflection of the 1800s once more. Significant quarantine zones are now in place across all of West Africa, in Liberia, in Sierra Leone, in Guinea as well. And they are all being enforced by military units. What are quarantines? Quarantines are essentially best understood as a political response to a medical problem. And they originated, of course, in the 1350s in Italy, when the Florence and Mantua and so forth were dealing with the bubonic plague. And of course, the medical community at the time didn't have any answers for them. So what did they do? They instituted quarantine. In a sense, you're looking at a similar pattern of behavior here by states that literally don't have the medical resources in place to deal with this epidemic. So what are they resorting to? They're resorting to cordons sanitaires and quarantines. And what you can see here, in fact, is that in parts of Monrovia, the capital city of Liberia, they have now cordoned off entire sections of the city. And this is West Point, which is a slum section of the city, which exhibits a very high rate of infection. Quarantines can be useful to a certain extent, but they can also be very pernicious. And in this case, quarantines are impairing the movement of food, of health workers, and of medical supplies throughout the country. In fact, in many cases, they're literally shutting down parts of the country to industry, to agriculture, and so forth, and ultimately to trade. So they can be very problematic. Travel restrictions are now going up across the region. Several nations have now banned flights from West Africa, including Kenya and South Africa, just to name a few. Some airlines have stopped service to infected countries, notably Air France, right? And that's a huge problem for global health workers because a lot of them use Air France to get to the region. So aid flows and aid workers have really been negatively affected by this, and it's becoming a bit of a logistical nightmare, which we'll come back to in a bit. So let's talk about a couple nations. First, let's talk about Liberia. On August 6th of this year, President Sirleaf, she declared a state of emergency in that country. And then following that, she instituted what is called Operation White Shield. White Shield is a military quarantine across the country, which is literally trying to contain the virus in certain districts and or what they've defined as epicenters of contagion. At this point, though, it's a real problem because, and I talked to people who have, as I said, have family in Liberia this morning, and in those units or in those areas which have been quarantined, people are literally running out of food. They're getting to the point where you're going to start seeing starvation in the next couple of weeks because food cannot get into these areas. In Sierra Leone, state of emergency was declared in July of this year. The government has passed laws totally restricting large public gatherings, no longer allowed. They have put in place a military operation called Operation Octopus, a military mobilization to quarantine vast regions of the country, and the country is going into lockdown. This goes into effect on September 18th, and it continues to the 21st, wherein literally everybody in that country will be confined to their houses, to their homes, so that healthcare workers can go from house to house to house identifying the sick. You are not allowed outside your house in that region. So this is a really draconian measure by the state in a desperate attempt to gain control over the expanding epidemic. One of the great concerns, aside from the morbidity and mortality we're seeing, is economic damage. And what we're seeing is declining trade throughout the region. So we're seeing declining trade within affected states, between regions. For example, agricultural goods can no longer get to markets in many cases because the farmers can't get to their fields to harvest them or to work them, much less bring them into the cities. You're also seeing declining international trade. A lot of the countries in West Africa actually import much of their foodstuffs, and since ships are no longer arriving in many of those ports, food imports are declining as well, which is setting up this problem with malnutrition and possible starvation. Of course, the declining agricultural production, I mentioned that. You're also looking at soaring food prices, and you can expect that in the region. For example, the price of cassava, which is a staple in the region, has increased over 150% in the last 2 weeks. That might not sound like a lot to you guys, but if you're living on a very limited budget in West Africa, these soaring food prices can be something that you might not easily substitute for in your budget. The most interesting stuff is, of course, the World Bank recently projected, I think about 3 days ago, that the epidemic is going to exert a significant drag on the GDP growth rates in the region. They are estimating that the epidemic is going to already generate a negative 1% drag on the GDP growth rate in Guinea and a negative 4% drag on the GDP growth rate in Sierra Leone. Now, these may not sound like significant drags on growth rates to you guys, but a negative 4% drag on a GDP growth rate is really substantive. And for a country as poor as Sierra Leone or Guinea, that's a nightmare. That is not easily dealt with. We have extensive problems with governance throughout the region. First of all, and this should be obvious to us, there's very low state capacity throughout the region. So the states in the region are very, very weak, particularly in the provision of public goods. The healthcare infrastructure is just awful throughout the region. There is a total lack of beds for Ebola patients. There's a lack of doctors and nurses who have either been infected or fled, and there's a real dearth of medical supplies. Just in terms of surgical gloves, surgical masks, protective equipment, all of this is just non-existent at this point. It's been used up. Other problems with governance, the perceptions of the government as increasingly repressive and illegitimate. And obviously, as the quarantines continue to be in place and you continue to see government troops crack down upon the citizens of these states, that's going to set up problems in terms of the people seeing the government as repressive. So the fear of the state is intensifying. This is manifest in terms of mass rioting throughout the region, which we're now observing, and increasing repression by the state. The consequence of all of this breakdown in civil society, the rioting, and then the cycle of rioting and then repression is that ultimately it's going to make it more difficult to contain the virus, right? Because people are not cooperating effectively. And so the fear is really manifesting in terms of problems of governance. And these are just a couple of quick slides of the violence in the region. On the top here you have a mob in West Point, the slum in Liberia, and down here you have a soldier beating on a demonstrator and so forth. So things are getting quite chaotic over there. As you can see right here, this is a photo of government troops in Liberia trying to calm down a mob. Right? The regional security implications in the short term, yeah, some regional political destabilization is possible. I would argue that you're already starting to see it. Zimbabwe has also withdrawn some peacekeepers from Liberia. I don't think the security card is massive yet, but I'm always surprised because on last Sunday, President Obama went on Meet the Press, and he declared that the Ebola epidemic was a threat to U.S. national security interests and to international security. One has to be guarded about threat inflation, right? And I wonder sometimes whether Washington tends to inflate threats. But in this case, and we can talk about this after the presentation, there may be some grounds for him constructing it in this way. The first thing that he said was that we have a fear that the mutation of the virus to a more transmissible variant is possible, and that's true. One of the odd things about viruses that we do know is that, and we saw this in 1918 with the Spanish flu, the faster a pathogen can spread in terms of its transmissibility, it will allow it to mutate faster and faster. All right? So, and that's not true in every single case, but it is frequently true. And so as transmission increases, as the rate of transmission increases, the rate of genetic variability in the pathogen can also rise as well, leading to greater mutations and variants. So as the epidemic spreads throughout Africa, we just do the math, right? If you think about 1,000 people with Ebola, not such a big deal. 10,000, well, you know, that's a significant increase. But if you're talking about hundreds of thousands of people getting it, yeah, then you have real potential for variation in terms of the genetic structure of the virus, and it could become more transmissible, at least in theory. The presidential declaration of threat that occurred on Sunday is useful in one respect because it's going to mobilize the U.S. military to provide aid and logistical support to these states and to NGOs throughout West Africa. Now, again, it's a double-edged sword. Some people are going to complain, well, you've securitized Ebola and you're now using the military, and getting it involved in issues of global public health. Fair enough. On the other hand, if the United States doesn't start to provide significant support to combat the epidemic, what's the likely outcome? Well, I would just say continued expansion of the epidemic because, frankly, the NGOs are overwhelmed. The WHO has not shown great leadership on the issue, and I'll come back to that. And so I think that the U.S. using military aid in a peaceful manner to help assist with the spread of supplies is probably quite helpful. So this mobilization is likely going to be through the African Command, and I'm not sure yet whether local forces from this region will be involved in that, but they might be. Are we losing the battle? I worry about this. First of all, let me say that I admire the mission of the World Health Organization. I think there's some wonderful people there, some very dedicated people. But the WHO's response to date on this has been inept. Specifically, they ignored their own IHR, or International Health Regulations. According to those set of laws that they set up themselves to respond to epidemics, they ignored them for at least 6 to 7 weeks before actually activating their protocols to treat Ebola. I don't know why they did that, but it flies in the face of global health governance. That's their own set of rules. Other problems that the WHO is not necessarily responsible for, the WHO is massively underfunded. You've seen significant cuts to it over the past decade that are just brutal. It's also politicized, the WHO, and it's compartmentalized, and the infectious disease units have really weakened over the years. In fact, it's difficult to deal with the WHO sometimes because they literally are focused to a great extent upon the chronic diseases of the wealthy in the world and not on infectious disease anymore, and they've largely dismissed infections as a major problem, and you can just see, well, this is what happens. NGOs are overburdened and underfunded. They're fighting a good fight. They're trying really hard, but they're just outgunned. The virus is moving too rapidly for them. So Medecins Sans Frontieres, Doctors Without Borders, are doing a wonderful job. Samaritan's Purse, SIM, and Project Cure are all very good organizations that are trying to contain this, but frankly, they're not going to be able to do it on their own. Is the Ebola epidemic an example of a black swan? I'm sure some of you are familiar with this notion of a black swan as being an event that comes out of nowhere, which is essentially unpredictable. Yes and no. I wonder about this. The problem here is that in many cases we use a thing called the availability heuristic. I'm not sure if you're familiar with that terminology. But the availability heuristic means that people base all their responses in the present and in the future to what has happened in the past. So because Ebola epidemics were always contained relatively easily in the past, at least since 1976, everybody always assumes that, well, the future will look like the past, and we'll be able to contain this epidemic quite readily using the strategies we've used before. Well, the problem with the availability heuristic, though, is it can actually lull people into complacency. And if you think, well, this will simply look like past epidemics of Ebola, you could argue that's what happened to the WHO, that they simply thought, well, it'll burn itself out quite readily and it won't spread that far. And of course, they were off the mark. So using the past to predict the present, to predict the future, isn't always going to work. The future may not look like the past. I would also argue that the response from the international community has been totally insufficient to date. Everybody has been waiting for leadership from the WHO. It hasn't manifested for various reasons. The NGOs are simply not capable of tackling it on their own, and so the sovereign states are getting into the mix. And I argue that the USA has to take a much greater role in terms of helping to bring this epidemic to heel. What are other problems we're going to be facing? Well, of course, the number one is enormous global inequities in the distribution of wealth. West Africa, and I don't know how many of you have ever been there, but West Africa is incredibly poor. And so global inequities of wealth have really translated into intense poverty, terribly fragile health structures, infrastructures throughout the region, and low state capacity. So those states, Sierra Leone, Liberia, Guinea, are not going to be able to control this thing by themselves. We don't have any vaccines or cures for Ebola, right? We have a set of experimental vaccines, but they haven't been subject to human trials yet. There is the ZMapp vaccine that appears to have, and I say appears to have worked in a couple of people, but again, we don't know. Those people might have survived anyway. We're not sure whether the vaccine works. And moreover, we certainly don't have enough of the vaccine to mount a significant response. The MAP Corporation just cut a deal with the U.S. government for $27 million to produce a new round of the ZMapp anti-Ebola drug, but it won't be available for some time. In terms of global health governance, I would argue it's just not happening. It's not happening in the way that experts in my field would have predicted it would have happened. A community of nations has not come together in any sensible way to battle this epidemic. Everybody has kind of left the West Africans to deal with it in and of themselves. And only recently is the United States stepping up to the plate and saying, well, we need to do something about it. Finally, radiating externalities from the disease. Obviously, the virus can expand its range. We've seen it jump from West Africa to Nigeria, courtesy of a fellow named Patrick Stewart, who was an American Liberian who got on a plane in West Africa, and courtesy of Patrick Stewart, unfortunately, it jumped over to Nigeria. So we know that airplanes can serve as vectors. It's not evident that he transmitted it on the plane, but once he got off the plane in Lagos in Nigeria, he transmitted it locally, and now it's happening there. So we know that planes and modern transportation technologies can spread it. But the other externalities that we're not talking about are the political and economic externalities that are going to intensify as a result of this illness, particularly if it continues to spread. And people just aren't really considering those consequences. So how can we help? First of all, why am I doing this? Well, because I think it's important that we start to increase awareness here in the United States, initially at CC, but then regionally and nationally, and indeed ultimately globally, because I think that one of the problems is that, we're going to need an intense and sustained effort by the global community in order to combat this thing and rein it in. I would also argue that if you're interested in helping, that we support a number of NGOs. Project Cure is working up in Denver right now, and recently they gathered $400,000 worth of medical supplies, which they're now shipping over to West Africa. So we're talking about protective gear to assist the medical personnel over there. Medecins Sans Frontieres also doing a wonderful job, SIM and Samaritan's Purse, and I would urge those of you who are interested to please support those NGOs and their good work. Finally, you might want to push your congressional representatives for increasing U.S. leadership on the issue. I do applaud President Obama's increasing engagement in the issue. I think it's really necessary and helpful, but we're going to need a sustained effort from the United States to assist. Future reading by just an incredible author of unimaginable genius. No, kidding here. It's a shameless plug, but these are the books I've written on the subject in recent years, and in fact, I'm starting another one. Okay. Whoops. Well, I'll go back to that, and then I'd be happy to take your questions at this point. So I'll get that back up. Okay. Any questions, comments? Don't be shy. Yes, in the front.
When you say transmission by bodily fluids, I acquire bodily fluids, do I put it into mucous membrane?
I'm not sure about, sorry, I have to paraphrase all your questions because we're live streaming. So the question is, can the virus be acquired through mucous membranes or directly through the skin? I believe, in fact, it can go directly through the skin. Now, I'm not a virologist, I'm a political scientist, but that is my understanding of one of the pathways of transmission. Yeah. Yes?
Who decides where to quarantine? Like, who decides that it is an epicenter of contagion and thus deserves to be quarantined?
Good question. Okay, so who decides where to quarantine and so forth? In each of the governments that are quarantining regions right now, it's typically personnel in the Ministry of Health. So in the Liberian Ministry of Health, they're looking at known case rates within certain counties in the country, and they're basing it upon that. Unfortunately, as of today, 14 of the 15 districts in the country are now all under quarantine. There's only one that isn't. So the entire country is basically locked off in an effort to contain this. Yes?
Why is this one different? Why now?
Yeah, that's okay. The question is, why is this one different? Why now? That's actually a fascinating question, and there are a number of hypotheses about that. One of the arguments is that with globalization and the increasing transportation infrastructural development of the region, you're now seeing the ability of the virus to move along roads and so forth that you didn't have in the past. Another thing that's going on is that this Ebola epidemic is taking place in West Africa, and historically most Ebola epidemics took place in Central Africa, where people were used to them. So initially the people of West Africa weren't familiar with the virus, didn't really know what was going on, didn't identify it readily because they hadn't seen it before. And moreover, the healthcare infrastructure is so terribly weak in that region that all of these things combine, I think, to produce a perfect storm for viral transmission and intensification. Okay. But again, we have seen this particular virus before. We have seen Ebola Zaire before, just not in this particular geographic and infrastructural context. Yes, Eugene.
Do you know, is the virus an RNA-based retrovirus, or is it DNA-based? Like, how fast does it evolve?
I don't know, but that's a good question. But luckily I know you and I can get back to you on that. Thanks. Okay. Yes.
I think part of the problem is that they're not going upstream fast enough to find out modes of transmission that are not in the default mode. I mean, clearly, healthcare is an amplifier of the epidemics, and so is managing the body's burials and these kinds of activities. But what they're not doing, as far as I can tell, is try to find out where people who did not get involved with healthcare or with handling the body and got infected, what their risk factors were. Because it may be that the difference between 1976 outbreak, I think it was in the Congo, I can't remember.
Democratic Republic of Congo, yeah.
And now is that there may already have been some sort of transmission capability that wasn't back then. And this is, to me, deja vu all over again, because the incompetence of the World Health Organization, they used to refer to it as the World Death Organization, is with the early days of AIDS, they finally took the responsibility of AIDS away from them because they were so incompetent and created UNAIDS.
That's right.
Right, and so, in answer to your question, is there a possibility that there be some international organization taking it away from WHO and creating sort of a UN Ebola or something like that?
Well, and it's going to be hard to paraphrase that long comment for the live stream, but I do take your point. Look, I think that, yeah, the WHO has clearly dropped the ball on this issue, and we may need to set up different mechanisms, different organizations in order to control this epidemic. In fact, I suspect we're going to have to in a certain respect. I would argue that, again, in terms of variance on this, yeah, you're looking at a number of different issues throughout the region, right, that didn't exist in 1976. Greatly increased mobility of populations throughout the region. I've delineated the other factors, but when you're talking about moving upstream in terms of contact tracing, right, again, that's incredibly difficult to do because at this point in time, we can barely staff the hospitals, right? much less send in viral investigation teams to look upstream in terms of contact tracing throughout the region. In fact, I would argue that contact tracing is almost impossible. That's why, of course, they're shutting down in Sierra Leone, they're shutting down the country for 4 days to try to get a handle on who's infected and who's not infected. But they're literally outgunned in terms of personnel. They don't have the staff, which is why the global community needs to get involved and help in that type of stuff. Dave.
You described a kind of vicious circle with regard to quarantine leading to political repression and fear of the population.
Mm-hmm.
But is there any alternative to quarantine as a tool? That seems to me to be the only thing available given the absence of vaccines and stuff.
Yeah, okay, so just to paraphrase Dave's comment, isn't quarantine and that cycle of rioting and repression almost inevitable in this type of context because the government lacks any other alternatives? And I would argue, yes. I think you're right. Unfortunately, when you're dealing with these types of circumstances where you have, almost non-existent healthcare system, right, that's clearly overwhelmed, what else is the government to do while it waits around for the international community to mobilize? And I would argue that and I see a lot of this right now, for everybody in the West who is complaining about what the governments of Liberia, Sierra Leone, and Guinea have been doing, I would put it back to the rest of us here in the West and say, well, really? Well, what have we done? Well, we've done nothing. So we've left them really to hang out to dry. And it's easier for us to criticize them, but I don't see that they really have a lot of alternatives unless they can somehow elicit help from the rest of us. And that's what I want to put on the table for you all to think about tonight, is that it's our moral duty to help them, but it's also in our own material interests to get ahead of the curve and help them. It's not just a moral quandary, it's also, as President Obama put it, in our own security interests and economic interests over the longer term to contain this thing while we can. Because if it gets out of West Africa and really establishes itself through the rest of Africa and even South Asia perhaps, or perhaps even parts of Europe, then you're looking at some serious, serious problems. Yeah, I'm going to go to the back now. Yes?
I just had a question with respect to the vaccine. Would it make more sense in a philosophical way to treat the healthcare workers with the vaccine initially so that they then are protected in terms of treating everyone else? Or is that inside a riot because the government is now getting the people? I mean, it's a free-for-all in terms of pointing the finger and saying that you're not supposed to segregate it in that way.
Right, that's a great question. So again, the question is, wouldn't it make more sense to vaccinate the healthcare workers initially and then start to distribute the vaccine to the general population? First of all, we don't have a vaccine, right? But if one were to be made available in substantive quantities, yeah, I would absolutely recommend vaccinating the healthcare workers first. And sure, that's going to promote some perhaps feelings of ill will amongst the populace. But if the healthcare workers continue to go down, there will be no one to treat the rest of them. So you have to vaccinate the healthcare workers first and then work on vaccinating certain segments of the population. Will that encourage rioting? Probably, yeah. But unfortunately, I don't really see any other pathways for these nations to take at this point. Okay, so we'll get some new faces in here. Yes, right there. Yeah, sure.
You mentioned the DRC at the beginning of your presentation. Would you be willing to say more about
Sorry, I mentioned the what?
Oh, the DRC and what's happening there?
Yeah.
How is it different than what's going on in West Africa?
Oh, okay. So how is the situation in the Democratic Republic of the Congo different than the situation in West Africa? It appears to be, and I know this sounds odd, and I see it as odd, appears to be that an entirely separate Ebola outbreak has occurred in Democratic Republic of the Congo. Now, again, you have to ask some questions and say, well, this seems odd. But then again, the University of Oxford just released a fascinating report about a week ago that shows that the belt of zoonotic transmission, so transmission from the animal reservoirs into humans, that belt of transmission from fruit bats and primates extends really across all the way from Senegal, south through Ivory Coast and so forth, all the way over into Central Africa. So if we're looking at transmission from, say, bats to humans, and they inhabit that entire swath of the continent, it's not entirely out of the realm of possibility that it might just be an entirely separate but naturally occurring outbreak. On the other hand, you might presume that, well, perhaps someone got on a plane, right, and disembarked in DRC. But there's no way of knowing at this point in time exactly what's going on there. That's going to take a little detective work to figure out what's happening. Yes?
So I have two questions. The first one is, how do we as the international community respond to the starvation crisis? Because that's really a humanitarian crisis.
Right.
And number two, as we're sitting here looking at how do we help, well, money, okay, give to Samaritans first because you know it will get there. But also, with food aid, how do we know our money will get to the people who need it, not the corrupt officials on the way there?
Yeah, great question. Okay, so the question was regarding the imminent starvation and food insecurity that's looming throughout the region. How can we be assured that our support is actually going to translate into support for the people in these affected regions? And that's a very good question because, as many of you know, the political regimes throughout much of that region are known for corruption and known for taking supplies for their own ends and not distributing them to the poor. I would argue that direct state support from the USA for those governments through food aid can be very problematic, and that's been shown in the past. Particularly, I'll give you an example. I used to work on U.S. relations with Zimbabwe, and much of the US aid to Zimbabwe was purloined by the Mugabe administration. So I know that this can happen readily. I think the great thing, though, about NGOs like Medecins Sans Frontieres and Samaritan's Purse is that they have a very good track record of making sure that that donations given to them actually do translate into positive public health and food security outcomes. And so what I would do is simply vet these organizations yourselves and look them up and see what people have to say about them. And those ones that seem particularly distinguished in terms of their track records, those are the ones I would choose to support. Thanks. Yes, James.
What is the Ebola crisis mean for global spending and priority setting? So do we have to shift away from disease-specific intervention instead of building the national health system? Or do we have to shift away from chronic illnesses like emerging diseases?
Oh, that's a good question. Well, okay, so just to paraphrase James's question a little bit, are the current prioritizations in terms of our spending on health out of whack? Is that a way of putting it? A little bit, okay. Yeah, I think so. I think so, and because one of the things that drives me crazy is that the nations, the OECD nations of the world, the wealthy countries of the world, tend to be setting the public health priorities within the World Health Organization and elsewhere. Because of this, what you've seen over the past 2 decades, and I've been following this intensely, is this prioritization of the chronic diseases of the rich Western countries, and less of a focus upon the diseases of the poorer nations of the world. And this, of course, translates into less and less capacity in terms of the World Health Organization in terms of fighting infectious disease. Many of those infectious disease units have closed down, or many of the veterans of them have left, right, because they're so underfunded that you literally can't make a career there or a living there for that matter. And so what this means to me is that the global health prioritization of budgets is really slanted in terms of the wealthy globally and not in terms of the poor. Now, there are some organizations that are trying to rectify this. Obviously, the Gates Foundation, okay? Gates and the Gates initiatives have contributed a lot of money to battling things like malaria, right? And other things like schistosomiasis and filariasis and so forth and HIV. And that's wonderful because that money is sorely needed. But within the WHO, I'm really concerned about the politicization of the processes and basically the belittling of infectious disease. And when you look at what's happened, I mean, cholera is still raging in Haiti. It's been there since 2010. We can all talk about how it was introduced, all right, and speculate on that. But the point is it's still there. It hasn't been taken care of, even though the World Health Organization and the international community said they would take care of it. They haven't. And that's what I worry about. When I look at Haiti and cholera, I think, wow, we didn't even contain cholera in Haiti. So are we really going to easily be able to contain Ebola now in West Africa? I'm not so sanguine about it. Right? And some people are, but I'm not. Thanks, James. Other questions? Yes?
What sort of education efforts have been made within the country to try to prevent the spread of the disease, the
Oh, you mean within the West African states? That's a good question. What sort of education efforts have been made within the West African polities in order to educate the populace about the virus? Actually, quite a bit. The Sirleaf administration in Liberia is really quite engaged in this now, and they're putting up huge murals all over the country and advertisements telling people, listen, you know, this is real. Ebola is really killing people, and you need to be very careful. The problem, though, at this point is that education can only do so much because the virus is so rampant. I'll give you an example. One of the great problems in Monrovia are the taxis. I don't know if you guys have heard about this, but people are piling into taxis, their entire families, to take sick loved ones off to the hospitals for treatment. But the problem is the hospital beds are all full. And so literally all these sick people are riding around these capital cities in these cabs. Now, you guys all know taxi cabs. Do you think they're disinfected routinely after every passenger? No, right? So what the WHO is saying now is that actually cabs are functioning as vectors of transmission because all it takes is one sick person in there to get their sweat and their vomit or their blood all over the seats, and then everybody else who gets in that cab is going to be exposed to that virus. So you can see how, you know, just even the most mundane thing like taking a cab ride now can expose you to it. And this is a problem because, you know, education is key, but it's gotten to the point where people are just so overwhelmed, trapped in their houses. I'm not sure what they can do without the help of the rest of the world at this point. Yes, in the back. Oh, John. Hi. That's a good question. Again, so just to paraphrase John's question, are quarantines necessarily good or bad? You know, obviously, I think that there are good and bad elements to them. In terms of the quarantine of West Point, which you mentioned, I think that that followed a certain event, right? I don't know if you recall this, but what happened in the West Point situation is that there was a facility for treating Ebola patients in that region, and that facility was stormed by a crowd. In other words, rioters, who basically went in, and 17 people who had an Ebola were then taken out of that facility and taken back into the slum of West Point. The government's concern at this point was that civil society was basically breaking down, right? You saw extensive rioting, and then they felt that because these Ebola patients had been taken back into the West Point community, there would be mass transmission. The other thing, though, that people might not know about is that those people who invaded that facility also took infected bedding, all right? So mattresses and sheets and pillows from that facility and infected medical equipment. So the Sirleaf administration was, I think, duly concerned about a massive explosion of the virus within West Point, which I think is now occurring. And so they were faced with a very difficult decision, right? In the context of not only the rioting and then the liberation of the 17 from the facility, right? But then the consequent stealing of all the infected or presumably infected materials that would then radiate throughout that community. I think the government at the time felt, well, we're going to have to close this thing down because it's gotten out of hand and civil society has broken down. The problem that you raised, John, astutely is that, well, doesn't that then set up a further cycle of violence wherein the people of West Point now look at the quarantine around them and think that the government is becoming increasingly draconian and oppressive? Of course, and it's going to stimulate further rounds of, you know, insurrection against the government and deeper mistrust of the government and questioning of its legitimacy. And this is precisely the same dynamic in many ways that occurred in France in the 1830s and in Russia and in Prussia and even to a degree in England during the cholera epidemic. This dynamic between civil society and the state was just one of increasing mistrust and friction and even ultimately paranoia. And so I really do see this occurring within the region, and I think it's probably, unfortunately, going to intensify. Yeah. Yes?
You mentioned it can't be conveyed by water, but with no proper
No, it cannot be conveyed by water.
With no proper disposal of bodies, is there a risk of
Okay, interesting. So the question here is, could contaminated bodies then distribute the virus into local water supplies? I haven't seen any data to suggest that's going on, but again, I would say the probability is probably not zero, but I haven't seen any data to suggest that that's actually occurring. I mean, so it's in the realm of possibility. We've never seen it.
Is there also anything being done about disposal? Is that something that's being changed or addressed?
Well, yeah, disposal is a real problem, right? So the question is there anything done about the disposal of corpses? For a long time, the governments in those 3 affected states had a real problem because these bodies of Ebola victims were literally left to rot in the streets. People would not touch them, including government forces. And of course, what does this do? Well, it incites panic in the local population. In fact, there was a riot outside of Monrovia back in mid-August because these bodies were filling the roads and so forth, and the state wouldn't dispose of them, wouldn't clean them up. And the people closed down the highway and said, are you kidding me? I mean, you are the state. You have to clean up the corpses and dispose of them effectively. But even the state workers refused to touch them for a long time. Now they're cleaning it up, but you can just imagine that in much of the country where people are dying in their homes, those bodies are not being disposed of properly. And they're probably going to continue to act as viral bombs, distributing infections throughout their communities. So that's a huge problem. Yeah. Jackson.
To what extent does the consumption of bushmeat remain sort of a risk factor in the spread of this outbreak, and have the governments of these West African states sort of done anything to combat that element?
Great question. Okay, so to what extent is the consumption of bushmeat throughout this region driving the epidemic, and to what degree have the governments in the region sought to curtail that practice? It's hard to know, but I suspect that it's a significant contributor to the entire epidemic. Again, it's going to take some time for us to figure that out. But the index case, or the first case of this, was in fact a 4-year-old boy. And so bushmeat wouldn't look like, I'm not ruling it out entirely, but it wouldn't look like necessarily an indicator in terms of that initial transmission. They suspect that fruit bats might be able to transmit it through their feces or their saliva or so forth. So there are multiple vectors or pathways of possible transmission. Now, have the states been educating people to stop eating bushmeat? They've been trying. But you're talking about a long-standing cultural practice in the region, right? And one of the things we know is that it's very difficult to get people to shift their cultural practices. Although, in the face of this particular epidemic, as it continues to rage, you might start to see people saying, well, maybe I'm not going to eat bushmeat this week. Then again, you have the problem of starvation, right? Now, if people are starving, what are they going to do? They're going to go off into the bush and get what they can to eat. So, you're looking at a very difficult circumstance here wherein the populations of these states are in a terrible, terrible position. Yes. Ev.
Well, as if what you said was clear enough already. I was wondering if you could look ahead into the future a little bit, because, obviously not an expert of garlic, from what I've read, and could confirm this differently, that some experts talk about it's simply a matter of probability, right? Where there's some combination of a virus that is airborne.
Mm-hmm.
And therefore we spread much more rapidly. And so what you described about, I think, the WHO or the World Health Organization in general, are they complacent because they think, well, there hasn't been anything indicating all the evidence is small? Would they have scrambled much more urgently if things were airborne? Or are you actually saying that, if it does happen, that there is an airborne, that they will be caught?
Yeah. Right. No, that's a good question. So just to paraphrase, so what is the possibility of the virus mutating into different pathways of transmission, particularly? Yeah, but airborne transmission. I will say that the probability is not zero. And so in many of the classes when we talk about this stuff, I will just say to the students, do the math, right? And as the epidemic expands from 100 to 1,000 to 10,000 to 100,000 people, and you think about the sheer numbers of virus in terms of any one human being, you're looking at an exponential rate of expansion of that population of viruses, right? And so if you think about genetic mutation and mutability, which is, of course, enormous amongst viruses. I mean, viruses, most of them adapt more rapidly than almost any other thing on the planet, particularly influenza, by the way. But we know that they shift quite rapidly. So one of the things that's interesting in this case is that one of the concerns echoed by the Obama administration is that as this thing expands its range and the number of infected expand, the probability, the sheer mathematical probability of genetic mutation intensifies. And what does that mean? Does that mean that it could become more lethal? Sure. Right? It also means it could become less lethal and more transmissible. And that's the nightmare scenario. Because in 1918, the influenza that killed 50 million people globally and sickened hundreds of millions, the case fatality rate was just over 2%. Well, Ebola's is up over 52%. So the real nightmare scenario is declining lethality, increasing transmissibility, which would mean that it become much easier to infect larger populations. Could it become airborne? Yeah. You saw some manifestation of that back in the Ruston outbreak back in the day. Right? Now, that didn't infect humans, it only infected primates, but we know that it is a possibility. Is it a very low probability? Still a very low probability at this point in time. But I want to emphasize that all viruses are moving targets, right? This is a fluid situation. And as more and more people become infected, the potential for that mutation increases. So it's not out of the realm of possibility that you could see some changes in terms of mechanisms of transmission. Yeah. Okay, in the back in the blue shirt.
Can you talk a little bit about the response of NGOs and how they fit into or don't fit into the larger global health?
Great, okay, so can I talk a little bit about the response of NGOs and how they fit into the global health governance structure? Look, I think that the NGOs are the heroes in this particular story. Medecins Sans Frontieres have really been in the vanguard of the response to this effort. They have been saying for months to the international community, you know, get it together, pay attention, mobilize, and help us. And it has just been perplexing to me to see the deaf ear turned to MSF by most of the other countries on this planet. Samaritan's Purse have been in there working tirelessly as well, Project CARE and SIM, all doing very, very good work. So to me, the NGOs are the great responders. And without the NGOs, this thing would be even far worse than it currently is. The problem with the NGOs, though, is that they're small and they rely upon donations and they don't have limitless amounts of staff. And so they can only do so much. And that's why I'm really encouraging each and every person in this room to think about supporting one of these NGOs in some way, shape, or form. Now, can the NGOs help to convince sovereign states like the USA to play a greater role? Yeah, and I would argue that they have been influential in terms of mobilizing the Obama administration to take a stronger position on this, and that's good. But the NGOs are a valuable component of global health governance, but they can't do it all by themselves. And up until this point, they have been doing it all by themselves, basically, and it's about time that the rest of us help them out. Yes, sir.
I feel like historically, massive outbreaks of contagion. What is it? What are the dynamics that finally bring it to an end? Is it massive outside resources? Is it civil society developing within the affected area, or is it just sheer draconian dynamics of the disease? And once you've killed 60% of the population, the rest of the community, or they survive? Right.
Okay. So to paraphrase that. Historically, what have been the mechanisms for controlling contagion in the past? Well, historically, I mean, up until the age of antibiotics and antivirals, usually what you saw was that states would attempt to use draconian mechanisms like cordon sanitaire and quarantine to contain these things. And the record on that is kind of mixed. Sometimes it's been felt that it helped and slow the spread of disease. But usually these diseases would just burn through populations, and those who were resistant would survive, and those who were not resistant would perish, and with all of the attendant economic and social dislocation, political dislocation that entailed. In the modern era, even in 1918, people tried to slow down the spread of the influenza. For example, Australia and New Zealand tried to slow it down by preventing the influx of migrants and trade ships and so forth. But even they could only delay it by a couple of months. In the SARS epidemic of 2003, though, the World Health Organization imposed travel restrictions upon Toronto and upon a host of cities throughout the Pacific Rim in order to slow it down. I think that worked to a degree. You didn't see SARS jumping from Toronto to other cities throughout North America, and so you might credit that a little bit with it, with slowing down the epidemic. But ultimately, in the case of Ebola, I think you're going to have to see a massive infusion of aid and expertise and supplies and help from the rest of the global community. Because I literally think that these people in West Africa, these systems in West Africa are completely overwhelmed. And I would like to say, that the people of West Africa could just, quote, get it together and combat this, but they can't. They cannot. Because you're talking about, there are just not enough nurses, not enough doctors, not enough beds, not enough ambulances, not enough protective gear, not enough food. It's a truly dire situation. And aside from it just burning through the population, I don't see any way of controlling it. And the problem, as I've said, is that you can't count on it just stopping in West Africa, right? Because of globalization and global transportation networks, there's no reason to think that we can just commit continental triage and say to the people of West Africa, well, you're on your own and it'll just stop there. I don't think it will. I think it will continue to spread. So I think we have a really vested interest in helping these peoples to contain this thing. I'll take a couple more. Yes, in the back there? In the vest, yeah.
I just wanted to interject some medical information.
Sure.
Because these questions came up. It is an RNA virus, but not a retrovirus. So it's a single-stranded RNA virus. And the intrinsic mutation rate is actually much less than influenza. It's probably comparable to hepatitis B's intrinsic mutation rate. And, we do have a paradigm from hepatitis B where there's endemic and epidemic infection in China with millions and millions of infected, and we have not seen mutation rates that have translated into the change of mode of transmission. So hepatitis B has not become airborne.
Sure.
So I think we could maybe use that information a little bit to calm down the fears of it becoming an airborne virus. And
Well, I don't think anyone's really. Well, I don't think there's a lot of fear about that. But I would say one thing in response to that, which is that I don't think it's necessarily reasonable to compare Ebola to a whole selection of other viruses because, as you know, they all operate in different ways and have different rates of transmission. The virologists I've talked to at Columbia and Dartmouth and elsewhere are concerned about mutation. And they are concerned about, an expanding population of people infected with this virus permitting different pathways. So you may not be afraid, but these other highly educated people are rather concerned about it. So I'm just a political scientist reporting what I'm hearing from the virological community. And I'm not ready to say that it's impossible, okay, for it to become airborne. Now, do I think it's probable? No, it's not probable, but it is possible. Okay, I'll take one more. Yes?
I was wondering if you could speak to sort of the timing of this crisis with other international crises. Does the international...
Yeah, it's bad timing, right?
The international community and the U.S. in particular, do they have both the capacity and sort of the desire to help with this in the midst of crises in Eastern Europe and the Middle East?
Well, that's right. Okay, so isn't the timing of this crisis problematic in terms of the international community is beset with a number of conflagrations that we're trying to contain at the moment? Yeah, that's right. Look, it's a difficult time out there in the world. President Obama is trying to steal my thunder right now by talking about ISIS. I mean, how dare he, right? But no, obviously the Islamic State is an enormous security problem for the entire Levant and Middle East region. There's no doubt about that. Obviously, the conflict between Russia and Ukraine is of enormous significance, potentially incredibly problematic for NATO and indeed all of Europe and the international order. I mean, Putin is basically, his vision of the international order vis-a-vis the USA's vision of the international order surrounding the conflict in Ukraine. And I don't want to get into that because the true expert on that is David Hendrickson, and he's sitting right here. you know, obviously it's very problematic. So the question that you raise is, does the U.S. have the capacity and the stomach to engage in something like battling Ebola? Well, first of all, I think that the President's statement on Sunday shows that we have the stomach to do it. Do we have the capacity to do it? Yeah, we have the capacity to do it. The U.S. military has enormous logistical capabilities. You know, we're not talking about a ground war here. We're talking about airlifting thousands of tons of medical supplies or shipping it over to West Africa. Can we do that pretty effectively? Yeah, we can. Is it going to cost us money? Yeah, it's going to cost us money. But I think it's in our own interest to get a hold of this situation as soon as we can and try to put the genie back into the bottle. The more we dither on this and the more the international community waits to respond effectively, the larger the crisis will grow. And as some of the team at Oxford have said recently, they said, look, we may have missed a window, right, for containing this thing. We may have already passed a decision point at which point this thing could have been contained at a certain level. And now we're looking at, you know, can we act before we cross additional thresholds in terms of the exponential expansion of this epidemic? And I don't want to find that out. I think we got to get moving right now. So I think we have the capability, and I think we have the leadership to do it. I don't know if the rest of the world will join us, but I think that the USA's got to do it. Okay. Thank you all very much.